Well, it is 5 after 5, so we are going to go ahead and get started. I'm Jen,
Hi, I'm Carrie.
and today we're going to go over a few housekeeping items really quick. So today, we're going to go through our slides and share with you the information we have. Any questions that pop up, please put them in the Q&A. Once we've gone through our slides, and there's not that many, then we will get to question and answers. So Q&A is where we're going to go to after we're done with our lecture. Make sure I'm going to keep microphones muted, at least during the first part. And then if we want more dialogue, I'll unmute us a little later. And we will be emailing copies of these slides to you the following day by tomorrow. And I forgot our poll. At the end of today's webinar, there will be a poll that will pop up. It's a quick, like 2-minute little thing. It's about 5 questions. If you guys would be so gracious to answer those to help direct us in what sort of webinars and information you'd like in the future. All right. Okay. So we are talking to you guys about hormones. This is a fun topic for us. This is a shortened list of the most common hormones in the body. I think the biggest thing to recognize with hormones is that when one hormone really gets out of balance, it works like a cascade. It starts throwing off other hormones. So some of our like sex hormones is our estrogen, progesterone, testosterone. That's going to keep a nice hormonal balance for us. And cortisol. A lot of people know about cortisol. That's the hormone that can really mess up your sleep.
Also, your daytime energy. If you have high nighttime cortisol, you won't sleep and you'll have low daytime energy. We have tests for cortisol levels.
Yep. Your norepinephrine, your thyroid. There's so many different hormones, and just one little imbalance, I think, can really throw off the way you feel. And so that's kind of what we want to talk to you about today. We tried to put up there's so many things that create, so many symptoms that people have that they don't relate to hormone imbalance. And I think that's really the big thing that we want to drive home today. Estrogen alone is responsible for over 400 functions in the human body. And so sometimes I think people, have, things like pain, problems with pain, and they don't relate it to their hormones. And, so there's so many odd types of symptoms you can see. What are some others?
Well, correct. In middle-aged women, 45 to 60, 65, it's not just about hot flashes.
No.
You can have, you can have problems with sleep, urinary symptoms, low libido, problems with dramatic changes like, for instance, osteoporosis. So hormone balances for all of metabolism, even the skeletal system. Totally. Which is your bones.
Well, and I remember when I was first going through the process of being diagnosed with hypothyroid, and my biggest symptoms were, of course, fatigue. And I had major bloating and my muscles hurt. Like I couldn't get through normal workouts, a walk, and my legs just felt like they were on fire. And everyone's like, I don't know what that is. And as soon as my thyroid was balanced, it was gone.
And mine, you have her list. Mine was constipation, dry skin, low libido, energy loss, especially in the morning, wanting a coffee by 4 p.m. Freezing hands and feet and toes and nose.
Oh, yes.
Freezing. Yes. Even under a heating pad or a blanket, still cold for about an hour. The metabolism is so slow. The blood flow is even slowed down when you have hypothyroid.
Totally.
Sometimes my hands will turn purple.
Yes.
She's seen it.
Yes. But they say cold hands, warm heart, right?
Yeah.
And how about eyebrows are another weird one?
I'm going to show everyone. Do you see the latter third of my brow? Let me turn both ways. It's missing. This is penciled in, by the way. Very, very low thyroid.
Yep. So thyroid's the outside of the eyebrow, and the inside is usually sign depletion of estrogen.
Right.
Yeah, estrogen depletion, or I guess estrogen imbalance, we should say. But so your eyebrows can start to tell. So that's even another thing where someone's like, man, I just feel off. And now I'm penciling in my eyebrows. What the heck is
and
going
I'm losing
on?
hair in the shower too much.
And getting old sucks. It's not getting old, guys. That's hormone imbalance.
Right. Because when you have optimal health, it doesn't matter what age you are. You could be 45, 50, 55, 60 and be tip-top shape.
And have full, thick eyebrows.
Yes. And radiant skin.
So another really odd one that I think gets commonly missed is the abnormal heart rate.
Oh,
Your heart rate can be elevated, and it can be high or low. And which is, I remember when I was first starting to read and learn about all the hormones in depth, and I saw that as a symptom. It's like, oh man, that's so rarely linked to hormones, and people don't totally get that. Sleeping, of course, is just horrible. If you've got a hormone imbalance, remember that all those hormones we showed you on our first slide, it doesn't have to be your sex hormones that are off.
Could be thyroid hormone, right?
Totally. Just cortisol levels being abnormal, or, really severe adrenal fatigue. Man, adrenal fatigue messes you up really bad too. So yeah. And the pain, I've noticed too, people who have just that unbearable pain.
With what? Low thyroid?
Yeah, it's a hormone imbalance. Totally. So not similar to me, like I had the muscle pain. Sometimes it's joint pain, but when it's just more pain that's tolerable, it's often signs of a hormone imbalance. So just things to think about, guys, when if you're one of those patients that says, my body's off, I know it's my hormones, you don't need to put your finger on it. That's enough to come see a practitioner who does these extra testings, who's not just going to check blood work and say you're within normal limits. Good luck.
Right. And if you don't know it's your hormones, just create a symptom list, come in and see us, and we'll go through your symptom list and equate it to hormone testing.
Yeah. What's going on?
Either pro or con.
So let's talk about that a little bit. There's 3 ways to test for hormones. There's serum, which is taking the blood, and there's saliva, and there's urine. And so serum testing, this is what traditional doctors are going to do. Our Western docs, they're going to draw your blood. They're going to look at your hormone levels. And
wouldn't it take so many tests for blood though? I mean, you could four different cortisol levels per day, all of the hormone. That's pretty comprehensive. We can do it all in one test kit.
Yep. Yeah. Well, which is why
we go with.
So that's one of the reasons why the blood tests are so inaccurate.
Right.
And to think about it, your body is made to maintain homeostasis. It's just designed that way. The human body is amazing. And so when, if you're feeling like crap, your thyroid or your estrogen or your progesterone's off in your tissues, but it can still correct your blood, you can come back with normal blood work.
Right. At the time of testing.
At the time of testing. Totally.
Right.
And so it's just a really inaccurate way. People do it, and people get treated that way and still feel off, is typically what we see. There is one exception to the rule of serum testing, and that's testosterone levels. So testosterone's pretty accurate, male or female. We all have testosterone. We all need our
free testosterone.
Yeah. Our unique balance. So that's a good testosterone checking blood levels. We love to see that. So that is the exception. All right. So we've got ZRT, the saliva test. So ZRT is a test that we do. It measures the amount of hormones in your saliva. So you actually you get a little kit from our office.
It has it looks like test tubes, and you spit in the tubes, and to create enough volume to be sent in for testing. We
Yeah.
can test two types of estrogen, testosterone, progesterone, 4 cortisol levels, and DHEA with that saliva test. Some people don't prefer it because often they're too dehydrated and they can't gather enough saliva to do that test. So we'll go on to talk about our other tests.
I had a patient really kind of grossed out by it too. She wasn't happy.
She likes to spit.
She's like, I can't do this. This is gross.
Spit in the test tube.
And I love her and she's amazing. So
This
it's
would
just
be
her
good
thing.
to read. Yeah.
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 Go ahead.
About 90 to 94% of our steroid hormones circulating in our bloodstream are bound to carrier proteins. Saliva contains an unbound version, which means it's more bioavailable to our system. So with saliva testing, you're going to get your unbound hormones. Also, the urine test would test unbound, free T.
Because that's what we need to see to be able to correct. So saliva testing is one option. That test is around $210.
$210.
$210.
And can be drawn up for males and females alike.
Okay, so then comes urine testing.
Our Dutch
test. So the Dutch test is it's another kit that we can give you to look at your hormones. And they come with little cards that
called dried urine.
Yeah.
Sampling.
So you pee on a little card and let it dry, and
not weird at all.
Nope. And once that's all done, you mail that in to them. And again, they send us the results, which is going to be a much more accurate profile. You
get a comprehensive test result from a company called Precision Analytical. It will tell all of your sex hormones, your adrenal hormones, your DHEA, your cortisol levels. And with this particular testing, it shows the pathways. In other words, if pathway from one hormone is directly related to another hormone, and you're not hitting that mark in your result, your measurement, which is a numeric number, that test is also going to tell you why you're not hitting that mark. It could be from a disruptor.
Absolutely.
From a organic disruptor like foods or environmental, and it tells you specifically. It's a fantastic comprehensive test.
Yeah, and I really like this one too because of the pathways, because some of those pathways can tell us, okay,
steroid,
you've got the right amount of estrogen, but what type of estrogen do you have? Is that are you making, are you on a pathway that's going to lead you to breast cancer, or are you on a pathway that's going to lead to optimal health and
so that basically is genetic, right? It's going to tell you a pathway that might lead to breast cancer
and what's interfering to lead to so we can correct those pathways.
So this report gives you why your body's not correcting itself, and in which area you need help.
Totally. And it gets so specific down to if it's the protein you're eating that's disrupting and shifting this,
or the vitamins
you're taking,
these are disrupting,
the coffee you're drinking. This is tea, by the way, not coffee. But yeah, it totally,
it'll talk about insulin resistance for obese folks and why you're having that insulin resistance and your pancreas is pushing more cortisol, why you have the belly fat. So this is a really, really comprehensive go-to test.
And it's really I think that it's so beneficial. I know the tests are, it's a little bit of an extra cost, but the information that it gives you is absolutely invaluable.
It's fantastic.
Yeah, it's priceless. Because it just gives us so much information, and we can truly get to the root of the problem and start making you feel better. And I can't tell you how many women I've talked to for years have been like, I just haven't been right, and things seem to keep getting worse. And really, when we can start to correct it, it makes a big difference.
You want to talk about the other leg of that test?
Sure.
Organic acid test, also known as oats.
Oh, I have that coming up.
Oh, okay. We'll wait.
Okay.
Okay.
Well, yeah, there's
Okay.
always more tests. And this is what really we just covered today. Some of the hormone testing that we do is really what we're covering, but it's so good to really dive a little deeper, I think, to get to the bottom of problems, especially problems that seem to be lingering and sticking around. And that's one amazing thing about our office being, so focused on integrative medicine. We do not fix you in a cookie cutter way at all.
Nor just treat the symptoms.
Nor treat the symptoms. And we also try to really promote all of the lifestyle techniques that are going to help you heal too, which is kind of where we're at here with troubleshooting hormones. So all of your stress relieving techniques, whatever that is for you, if that's a walk a day, if that's coloring, going to the gym. Going to the gym actually is a good one that should help you quite a bit, and balancing hormones as well. My favorites, yoga and meditation, cleaning up your environment, checking your cosmetics. Cosmetics for women are huge, huge, huge source of hormone disruptors. So I put the website on there, ewg.org. I love that website because you can go and look and check up and look at any of your products and find it actually scores how clean your product is.
Makeup?
Yeah. Makeup, lotion, face creams, dry shampoo.
Oh, right.
So dry shampoo is a big one for me.
Right.
And a lot of the dry shampoos are really, really toxic and full of garbage. And
formaldehydes.
And I'm like, hey, I'm a mom. With naturally curly hair, I cannot wash my hair every day.
Spray and go.
I need a clean dry shampoo. So
You found one, didn't
I
you?
did, and
What
I love
brand
it. It has like the word it's mermaid or something.
Oh,
I don't know,
nice.
but it's got just cornstarch. It's all natural stuff.
Oh, nice.
Nothing that will disrupt, and it can take away those little shiny roots and
That's the only purpose for it. You're not supposed to, right?
Yeah.
Just spray it on the root anyway.
Absolutely.
So
And this one's a
fluffy your
powder.
hair.
It's a powder
Oh,
too.
okay.
It's not the aerosol.
So you just dust it on and.
Yeah, and I'm good to go.
Okay, cool.
And my mom hack. That's a huge mom hack. When I learned that stuff existed, my life changed. So when I started cleaning up everything, I'm like, you can't take away my dry shampoo. But makeups, a lot of the makeups, if you're going more mineral based, you'll see that really helps. Okay, change your diet.
Is exercise on there?
Exercise should be on there.
Exercise helps balance hormones.
Well,
too.
that's what I was saying at the beginning.
with the
really,
yoga
and the walking and going to the gym. Yeah. And weightlifting, actually, all of that. No, this was a short little summary.
Let's talk about the diet.
Yeah, let's talk about diet. Diet is huge, huge, huge with hormones.
Disruptors.
Our main disruptors with the diet. Oh, so B complex too is a good one to help you balance out. Okay, so also in the Dutch test, before we totally dive into diet.
Okay, I can read some
Okay.
few points. So our Dutch test, also known as our oats test, tests our B12 and our B6, our glutathione markers. This test will indicate whether they're low or high. Also our dopamine metabolite, norepinephrine and epinephrine metabolites, melatonin, and oxidative stress. So for instance, oxidative stress, it gives you your DNA damage, it's measured, and then it'll give you a recommendation like walking for oxidative stress.
Yep. And it's really specific.
So
too.
Again, giving you specific information of how to fix these issues, not just, oh, this is what you have, follow 8 simple rules. See, it goes very, very deep.
Absolutely. And what I like about that too is, say their glutathione is super, in the toilet, right? Well, then we can come back and show you during our treatment recommendations in the IV room why that's going to help you so much. And for you specifically, if those markers come back that way, you're going to feel a whole heck of a lot better.
Right.
Your liver's going to be functioning. Happy liver is happy hormones.
Yeah, whether it's through IV or supplements, but IVs are better because they can be metabolized through the liver a lot quicker than taking supplements with a disrupted GI system.
Yeah,
It's a
and
slower avenue.
and there's glutathione like for example, by the skin, through the skin, you spray it on.
Yeah.
And it's
Tell
I
our
love
audience
I love
about
it.
the effect.
I love it for my face
Tell
because
'em.
it lightens dark spots. So I've had melasma and I get sunspots anytime I'm out in the sun.
So we have a spray on glutathione.
Yeah. Although it smells like rotten eggs. So
Yes, but it's supposed to. It smells
supposed
like
to.
a. Let's see. What is the name of the outdoor sulfur water?
Yeah, it's like sulfur.
Sulfur
Yeah.
water. Yeah.
But you spray it on and you leave it on overnight and wash it off in the morning. So it's not like you have to go into public smelling like
Were
that.
your results 3 or 4 weeks in?
Oh, I think maybe
mean-
by 3. It was really fast. But I was religious. I'm like,
Mhm.
I don't want to
Use
look
it.
old.
Use it every night before you go to bed.
Yep. And it helps, our liver always produces it. And as we age, we produce less and less. So that's definitely one of those things that I like to support and add in, mostly for vain reasons because it makes your skin pretty. So glutathione's awesome. We love that. Okay. Our top disruptors. Dairy is probably number 1 for sure. Numero uno. And when we say dairy, a lot of people are like, okay, I'll give them my milk, but not my cheese.
But not my cheese.
So
or my creamer in my cup.
And think about the cheese too, because cheese is concentrated like milk basically.
Milk fats.
Yeah, and so you've taken all the estrogens and hormones from the milk and concentrated it down into a big, nice condensed lump of hormones. Is really what you're ingesting when you eat cheese.
Try it at home, Jen.
Cheese will mess up your hormones if you're sensitive to them, which most of us are.
Can Cinco de Mayo be a cheat day for cheese?
Hey, there's some
Tacos.
pretty amazing vegan cheese on the market these days.
For your tacos.
And Blaze Pizza, by the way, has we get no credit for any of this stuff. But Blaze Pizza makes the best vegan pizza on the planet.
Is it cauliflower crust?
No, I get the vegan crust. I think the cauliflower crust might have cheese, but they use like a cheese that totally melts. Like when you bite into it, it's stringy and stretchy. It's delicious.
Yum.
There's a good one from Whole Foods too, but they don't put cheese on it. And there's just something, I like it, the cheesy
Jen,
flavor.
should we mention soy or are we taking that off the table? I can't recall.
We're
chatting, but we're going
see if there's questions.
Okay.
Which means there
because
will be.
in the not too recent past, soy was a big hormone disruptor.
And soy was on this list, no matter what practitioner you talk to.
Right. No soy, no soy.
Yeah. And a lot of the new studies are showing that kind of isn't the case.
Because it doesn't disrupt estrogen, leading to breast cancers.
Right. So soy is a mixed bag. You will find practitioners in 2 camps with that. My biggest thing with soy is making sure that it's an organic, non-GMO, because like 90% of the soy products in the United States are GMO, genetically modified. So it's going to disrupt your GI system, which is going to disrupt your hormones.
Yes.
So eating, non-GMO food and organic foods whenever possible should be on this list too, because all of the pesticides and herbicides and chemicals they put on our food these days also disrupt our hormones.
Okay.
Absolutely. Another big one is gluten. Gluten is the gluten. Again, this is kind of a United States thing. You can go to Italy. There's even people with celiac disease who can go to Italy and eat spaghetti. Yeah.
Spaghetti in their bread.
Yeah. And they can't in the US. And we've just really changed, the way we do a lot of our practices. Yeah. With farming and processing food, but avoiding gluten. Everyone with major hormone disruptors, autoimmune diseases, gluten really needs to be at the top of your list. Gluten and dairy for everybody. Your food's rich in saturated and hydrogenated fats. So you're going to see that in your processed meats. And that means no hot dogs, no steaks, lunch meat.
Lunch meat.
Yep. All that stuff is pretty bad. And I threw stevia on here because that's a tricky, odd one.
Oh,
So
I
everyone's
wonder
like,
why.
wait, why is stevia on there? Because isn't stevia healthy? Well, again, it's the way. So yes, stevia is a plant and it can be processed in a very healthy way.
Okay.
And it can be processed in a really horrible way.
Like,
And if it's not processed in a clean, organic way where they're not adding a bunch of garbage to it, it can disrupt your hormones because it will still disrupt our sugar levels and everything.
Right.
And sugar is another one too, of course. This list is by no means all inclusive.
Well, would this include also the besides the plant sugars, the processed sugars like the sucralose and
Oh, sure.
sugars?
Yep. I would say sugars
sugars.
and artificial sweeteners. Yeah. Monk fruit tends to be much safer. From a lot of the studies they show, they haven't seen monk fruit do a lot of disruptors. And I'm not sure if it's just the fiber in there or why that's a little different. I also like maple syrup and honey too for more natural sweeteners. They're not going to spike your insulin levels as much. I put stuff in hot drinks. I drink hot drinks all day long because I get a scratchy throat really easy. So I use maple syrup because honey at high temperatures can be toxic too. Yeah. So that's our spiel on stevia. And this is like a calm ocean when you get your hormones in balance. We love it. This is the end of our slides. So I'm going to stop our screen share. And I see questions in here. So remember, you guys, any questions that you have, please feel free to pop those into the Q&A section.
Shall we look at some of these?
Yeah.
How about this one?
Okay. Will your eyebrows grow back if you get on the right thyroid meds?
And then that would be a period of time.
Yeah.
I don't know what that period of time would be.
So yes. And getting your thyroid back to balanced can be a juggling act, but oftentimes you'll see, I see eyebrows, like my eyebrows have grown back in for sure. Not completely to where they were before, but all of I was losing so much hair and I had major bald spots like up at the top around my head. And even in the back under my hair, it was really thinning and out, and all of that's grown back in. You can see a ton of short little hairs, which is a pain when you're doing your hair and you don't want them sticking out everywhere. But yeah, that's definitely a good one. Okay, so does turmeric root, 95% curcuminoids, help with estrogen replacement? Is it good to take during menopause?
It's not an estrogen replacement. It's good for metabolism.
Yeah, it's going to support hormone balance.
Is she asking if it's a direct replacement? Is that what she's saying?
Help with estrogen replacement. So I do like turmeric root for sure, and taking it with pepper, or if it's a supplement, to make sure there's pepper in it. Black pepper, so you can maximize the effects of that. But again, trying to find out why your estrogen is needing to be replaced in the first place. So what are we doing that's really like kind of throwing in the imbalance? But I think a lot of those types of supplements, like the natural stuff, I love maca root for hormone balance.
Oh, that's a good one.
Ashwagandha is another one I love, especially for people needing more thyroid hormone balance. And is it good to take during menopause? Yes. And another supplement that I don't see recommended too often, but I've always seen really good results with during menopause is evening primrose. A lot of women really start to balance out with that. And if you really want to go way more natural than that, you can support it with essential oils too. But essential oils, overdoing it on the wrong ones can
Mhm.
also throw you off. So
Mhm.
it's get with a healthcare professional and be knowledgeable about the essential oils because I think they can make all the difference in the world when used
There's a
properly.
balance.
Yes,
Mhm.
there's always a balance.
Mhm.
Okay. We did that one?
Mhm, this one.
All right. Will your,
Did that one.
thank you.
Mhm.
Okay. You want to do meat B complex and why?
For purposes of helping with your entire metabolism is B complex. B complex also helps with blood circulating and hair, skin, and nails.
Mm-hmm.
It's also good for energy.
And when your hormones are really off, we like to see methylated Bs
Mhm.
for you.
Prescribed. Mhm.
Yeah.
What else we got?
We've got, what is your opinion of a 52-year-old woman still taking birth control pills, mostly as menstrual cycle control? She gets terrible migraines during the cycle.
I don't know about stopping your
I
menses, especially.
I would
Perimenopause.
love to see you do a Dutch test and let us support that and get you off of the oral estrogen
Mhm.
and get you onto something that's going to be much more bioidentical
Mhm.
to you. It's going to be more gentle as a cream.
Mhm.
The oral estrogens can predispose us sometimes to bad pathways.
Mhm.
So I think there are better options for you.
And it's all because of the
Yeah,
headaches.
and for migraines,
I would troubleshoot the migraines. I would start there.
progesterone cream for
Yeah.
migraines is
The back of the neck,
a game
top
changer.
of the head,
I
back of the
had
neck.
I had migraines all the time, and
Mhm.
when I started using progesterone cream like a
Mhm.
year and a half ago, my life
It's
changed.
been a game changer for me. I've been using progesterone cream for
and
6
and
years.
sleeping too.
Oh my
With the
gosh,
progesterone
yes.
cream, it changes like when your sleep
Mhm.
patterns are really disrupted.
Mhm.
And you can get them even with vitamin D in
Oh,
there,
that's true.
and
And lavender. No?
yeah. Oh,
Yeah.
yep. There's all kinds of stuff. So, it's hard to say without seeing and knowing your exact case to give medical advice, but I'd love to see what a Dutch test looks like on you
Right.
and get you on. I think we could do better.
And troubleshoot where are your migraines coming from? Is it because of food allergies? Is it because of stress? Think about, you kind of have to break that one down a bit.
Mm-hmm. But that's a good question. Okay, if you're taking medication, for example, thyroid, will these tests still give you an accurate picture of your hormone levels?
Yes.
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 And so even if you're on estrogen cream or progesterone,
anything. It's going to give you where you are at,
yep,
from where you are at and what you have been taking. A
absolutely.
picture.
And you tell them that when you get the kit and you're taking the test, you
Mhm.
fill out that information,
Mhm.
and we know as the practitioners too what you're taking currently, so we're able to make adjustments. And sometimes those are micro adjustments. And you'll see, I've seen Dr. Cora do this a lot in our office, where she's going to order or give you a prescription for estrogen and a separate one for progesterone,
Mhm.
2 different creams that you put on. But that way, as we're titrating and changing things, if just one of those changes, you're not throwing away a ton of medicine. It's just we can up level or change doses a
Mhm.
little easier. It's easier to play with. And that's kind of another thing too. I think people don't realize over time your hormones will continue to change. So we can get you totally balanced and you're
Yes.
feeling great 3 years. The world is wonderful. Birds are singing and there's
Mhm.
rainbows everywhere. And one day you wake up to a storm.
Sure,
it's
right.
a mess
Because when
again.
you're young, there's a reason why your hormones are not in balance. Like, that could be food related, it could be diet related, it could be stress related. As you get older, the ovaries start to lose, estrogen, and things just kind of fall off the cliff.
Mhm.
As we age. So then we can show support with bioidentical hormones in that case.
Yes.
Mhm.
Yes. Okay, so here's a thyroid question. I have Graves' disease. I've been taking Synthroid, not
Uh-huh.
levofloxacin, because my original doctor's advice, I think, was good advice. Although lately, after I've taken my pill, which is by itself, an hour on each side if possible, It's making me sick and I get dizzy. I get
So I'm wondering-
bloated sometimes. It's different than it used to be after I take it.
Mm-hmm.
And by the way, I do understand that 75% of my thyroid was environment in the first place. Careful with what I use nowadays. Okay. So that one, great job cleaning up the lifestyle, the 70%. I always tell my patients, I feel like we're all born with a credit card. We're given a credit card at birth with different terms and conditions. And so what Carrie might be able to tolerate it with household cleaning products or makeup
would send your eyeballs spinning.
Right. My eyebrows would be gone.
No, your eyeballs spinning.
Yeah. So one, good job with that. And Synthroid is a synthetic drug, and typically what we see,
it might block conversions.
Yeah, absolutely.
Right?
Yeah.
Okay. Jen's going to tell you.
Well, so with it being a synthetic, hormone replacement, it definitely can actually block certain conversions because you need your certain hormones to go down, they start to convert into different pathways to make your body feel optimal. I would say that it sounds like if you're getting dizzy and feeling bloated and it's treating you differently,
it might be too much dose.
Yeah, I've felt that way before when I was on Synthroid. But also, we've changed a lot of our patients over to my personal favorites, NatureThroid.
I love NatureThroid.
NatureThroid, just women are happy on NatureThroid. I just can't tell you what it is. It's so much more natural and it gives you that T3 and T4. But NatureThroid right now, before I get 5 things in here and we're all sad about it, it is on national back order with we don't know when it's coming back. We're all waiting patiently. And most of us who have been taking NatureThroid are currently on Armor Thyroid too, which is another, it's way more natural. And I'll tell you, my hair never came back in until I got over to the natural stuff. That's what made my hair come back. And I was on Synthroid and Cytomel, 2 synthetic drugs, one for, T3, one for T4, because I wasn't converting. So yeah, there's definitely something going on. And unfortunately, what happens sometimes in situations like this is they draw your blood. They say, you're within normal limits. We're not doing anything. And so we just remember to be your own advocate. If you want to keep going back to your primary or your endocrinologist, be your own advocate. Ask for some functional medicine testing. Those are totally within your rights to get the testing that you deserve to find out really what's going on with your.
That's a good point. Just because labs are normal, that doesn't mean I have A to Z symptoms. I do have A to Z symptoms, and I want those relieved.
Right.
Yeah.
Labs
it's
are
all
normal.
about feeling good.
Exactly.
I don't care what my lab says.
Yes.
I want to feel better.
Right.
So,
you can tell me my blood works great. Or it's kind of like the theory with weight too. Like so many people get stuck on a number. I'm like, I can get on the scale and you can tell me I'm 300 pounds, but if I look like a supermodel in a bikini, I'm happy. I don't care what the numbers are because that's not what we're going for, right? We're not going for numbers.
You're so funny.
What's the cost of the Dutch test?
A Dutch complete would mean you're through with your menses, perimenopausal or postmenopausal, or have had a hysterectomy minus the uterus. You can do Dutch complete test. That cost of that test is $250.
So it's anywhere from, because there's a couple of types of Dutch test. And if you have like a lot of adrenal stuff going on,
like your patient the other day.
we might add a test with adrenals, and that's what, $500. So there's kind of a range on the Dutch. The Dutch complete, mostly what we discussed today was the $250 one, and that one's really good for most people. And there's definitely, more we can do if adrenal fatigue is a big thing. And again, even with adrenal fatigue, the first line of defense on that is pulling out those high food triggers to stop disrupting your hormones. And a lot of practitioners really suggest a vegan diet because it eliminates
The dairies and the
gluten-free vegan, and you've
Right.
eliminated all of your hormone disruptors.
all of your triggers.
Mhm. I know not everyone loves hearing that, but it's the simple answer.
When you love food, it's hard. And when you love your favorite foods, it's even harder.
But you stop craving it after a while.
Yeah.
I definitely did.
Maybe start titrating on cheese. If you eat cheese 4 out of 7 days, eat cheese 2 out of 7, and then go to 1 out of 7. Like titrating a medicine.
Yes.
Take it slow.
Changing your diet doesn't have to be like jumping off a cliff. It can be baby steps down the mountain.
If you deprive yourself, you're going to be miserable.
Yeah.
For sure.
Yeah. Well, and I think also, just for success, making goals that we know we can
Attainable.
achieve.
Right,
Yeah.
right.
I
Attainable.
can cut it down to 3 days a week of cheese. It's better than 7.
Yep.
So yes, it's better than 7. And if that's what you can do, then that's your goal right now.
Right.
Okay, which brand of glutathione should I use?
Well, we use the RO. Is it R or RO?
RO?
AURO. Spray, glutathione spray.
Yep, we have it at our office.
So it's transdermal. Basically, you spray it in the palm of your hand. Where's my screen? Spray it in the palm of your hand. And then you quickly disperse it. You can do your neck, your face, the inner folds of your elbows, the thinnest part of your skin, places that you would apply progesterone cream.
Yep. The face it's amazing for those dark spots, and I love it.
It works for dark spots. Yes.
Yeah. If that's not an issue for you, some people even spray it on the inside of their forearm and kind of rub it on their tummy. That way their face doesn't smell. You don't smell it. And that's okay too. It's a great way. It absorbs beautifully through the skin. It goes right where it needs to. The body's so smart. It does everything you need.
And in our clinic, we offer what's called pushes. So we insert a butterfly needle into the vein and use 5 cc's or 10 cc's of a glutathione push. Goes right intravenously.
And we can do that, or even an IV with it. And it's so good for like antioxidants, preventing disease, helping support the liver. The whole beauty thing is a lovely side effect of all of the health benefits of taking it.
I wish you could promote your beauty side.
Do you have any I can't talk. Can you read?
Do this, yes.
Tips and tricks on how to slowly transition.
Tips and tricks and lipstick on how to slowly transition into a non-dairy diet. I would say very slowly. If you normally have creamer in your coffee and milk on your cereal and a block of cheese, a chunk of cheese,
cream cheese
on a
the
sandwich,
bagel.
yeah. So that's 5 times a day. You're giving yourself hormone disruptors. I think a good idea. I don't know. I work a lot with my mind, so I try to tell my mind that if I'm going to do something, why am I doing it? And if it's bad for me, I try to talk myself out of it. Basically, like this isn't good for my hormones. Why am I eating this? I could have celery and hummus. Why am I eating a chunk of cheese? Why am I having pizza?
Totally.
Because I'm disrupting my hormones. What's that going to do? Make me feel kind of like crap for the rest of the day. So
yeah, and I think too, it's kind of like making a list, like kind of like Carrie said, where's your dairy coming in, and then really trying to phase out one product at a time. So I used to love yogurt. My morning yogurt.
I don't even need it anymore.
Yogurt and berries.
Yep.
For years and years and years. Like that's the only thing I had for breakfast. And I'm like, well, if you take that away, what the heck am I going to have for breakfast? And I have gone into smoothies are wonderful. And there's so many dairy alternatives for yogurt that are delicious.
Yeah.
There's So Delicious. There's almond. My favorite's coconut.
Coconut is so good.
Coconut one's so good. And it's, you can buy them in the grocery store now, and even little yogurt cups if that's your thing. The other big thing that I had when I first went vegan, I was vegan for about around 9 months, and I went back to vegetarian so I could put my yogurt back in, and then switched back to vegan the last about 4 years.
So you added the yogurt and then you took it.
Yeah. So I was vegan, for about 9 months, slid back for a while. And
so when you brought the yogurt back, how did it make you feel? was that a factor in taking it away again?
Oh,
I don't know.
I
mean,
had pimples like a high school kid. It was
Okay.
total hormone disruptor.
See,
But
she took it away. She felt good. She brought it back. She got sis.
which is also why, so that's another big clue too.
What?
The if you're like, okay, I could do all of these things, but I'm not giving up my yogurt.
Oh,
That's
that's the
usually
one.
your trigger. If you're
Mhm.
like, I can give up all the dairy in the world, but not my cheese, that's your trigger. So it's an unfortunate way of how the microbiome works in the body. It doesn't feel fair, but I promise you, the thing you're craving the most on those disruptor lists
Is the biggest
it's your
disruptor.
it's your culprit.
Well, probably because that's your prominent food that you eat
Yes.
the most of.
Yep,
Okay.
definitely.
And the more you eat something, as we know.
Well, and another thing too, when I was
Mhm.
switching to a vegan diet, that the first time, part of the reason I failed,
Mhm.
Carrie, like you said, mindset so big,
Mm.
is I was expecting,
Yeah.
I was expecting my new diet to so say I wanted to put cheese on some vegan tacos.
Okay.
Well, I wanted that cheese to taste just like the regular cheese, or
What'd you do?
I wanted this hamburger to taste just like that hamburger. And so, and that's how
So it's a flavor thing
a lot
then?
of people transition, because, well, I think it's more like, I'm used to my spaghetti and meatballs. I'm used to my
Mhm.
hamburgers and
Mhm.
fries. I'm used
Mhm.
to my tacos.
Mhm.
So then they want vegan tacos, vegan hamburger and fries. And,
so you're still eating.
so, and then it's not the same. And so what I had to
Wow.
do was break everything that I was eating. I left my routine and I learned brand new recipes
Mm.
that didn't have fake meat. I don't do any of the fake meat.
Good.
Actually, I don't buy the fake cheese. I'll order it at restaurants.
Mhm.
Because it's just fun to eat that, since I don't do that at home.
Mhm.
But I don't buy the fake mayonnaise.
Mm-mm.
I don't buy the stuff that's trying to mimic unhealthy American food. I just went, it's like, nope, I roast veggies and my carbs are roasted sweet potatoes and quinoa and
Mhm.
beets and, all of these amazing healthy foods. And so I just had to really break that mindset, like, because I'm like, I'm sick of like these veggie burgers. They're not that good.
I've had them a couple times.
And they're okay. It's just, for me, it made the transition harder, trying to take my spaghetti and make it vegan spaghetti versus just make a whole new cool vegan stir fry, and then
Out
it's
of
a fun new
something
food.
else. Right.
And then you don't have that expectation either of it tasting
Love
the same
that.
way.
No, I love that idea.
Yeah, that made a big difference
I love that idea.
for my transition.
What else?
What are your thoughts on agave as a substitute for processed sugar? Awesome. I love it.
Mm.
It's low glycemic index. It's got fiber. It's from a plant. I would go with organic. It's been quite a while since I've read on agave, but I can't remember what it was. I think there might be one pesticide that's commonly used on those plants, if I'm thinking, if I'm remembering correctly.
I'm not sure.
So I feel like organic was, or it was something they put in during the when they process it down, but it's very minimally processed. I think agave is awesome. And I used that for quite a while.
Would you take agave over local raw honey? Would you differentiate between the two? I don't know.
It depends how I was going to eat it. If I was going to put the local raw honey in my tea, I'm going for agave.
Gotcha.
Because of the endotoxins in the honey.
In the heat. Okay.
But if I'm going to drizzle it on a bowl full of berries, I'm going for the raw local honey for all of the, good stuff around to support allergies and things like that. Yeah.
Okay. I'm on a thyroid pill. Can I still supplement with ashwagandha? Can I still supplement as well? Of course.
Yes,
absolutely.
I think it helps. And selenium, just having all of those thyroid supporters. Holy basil is another one. Especially, where I see holy basil work so amazing is on people with that mild anxiety from the hormone disruptions.
Use tau.
No, you take it as a daily supplement. If you need to.
Okay.
When I was a professional athlete actually for a few years. And when I would get on stage, I'd get those little jitters, and I didn't like that feeling.
Did it have a calming, relaxing?
It took the jitters
benefit?
away, and I'm like, I can
Really?
just get up here and be a rock star.
How many holy basils does it take to stop a jitter?
Yeah, just one
One.
little, like.
Did you hear that, everyone? Performance anxiety, all you performers out there, take a holy basil.
Or if you just have that daily mild stuff, it's an
Mhm.
adaptogenic. It's going to support beautiful hormone balance. It's not
Great.
addictive.
Mhm.
So yeah, holy basil is one of my. And I've had other people who suffer from anxiety and tell me that I'm absolutely crazy and it doesn't do anything.
So they've tried it.
A few,
Mhm.
and some people absolutely freaking love it because it really does take that edge off. So I think it's everybody's different.
Maybe a different person might have
Mhm.
more cortisol, and so it would take more than a holy basil to
Yep.
kick that down.
So we have just a couple questions, guys, and then we're going to have to wrap it up because we're
this
getting
is for
close to
sure.
our
And you
time.
may have already answered that, but this is a yes.
Can yogurt be bad for leaky gut?
Absolutely.
Yeah. If you've got leaky gut, please avoid dairy.
Mhm.
It's gonna really just disrupt things and make it worse. And I understand quinoa can be bad for leaky gut as well.
Well, it's a grain. I mean,
Oh, it's tough because it's a
Mhm.
seed.
mhm.
It can be. If you're really having troubles with leaky gut, the best thing to do, well, it's our 4 R's, but the best thing to do would be to pull out nuts and seeds and grains, your dairy, your gluten, and really just give your digestion a break and be really, really simple with things for about 30 days.
Go for the leaky gut protocol.
Leaky gut protocol. We
Mhm.
can help you with that. We could even do a webinar on that, actually. So,
I mentioned it in my brain to gut health.
okay.
I listed the protocol. If you listen to the brain to gut health webinar from 2 weeks ago, there is a slide in there that tells the exact leaky gut protocol. Just things you can find at Whole Foods or vitamin stores.
Yeah.
Super simple, but it does take 12 weeks.
Yeah, it's
9
a
to
12
12
week
weeks.
process.
Mhm.
And then after that, you add
Mhm.
in one thing at a time and see. So
Right, that's a
oddly
good
enough,
point.
quinoa for me is much easier on my stomach than brown rice.
For sure.
Yeah. So
Mm.
it really, and listening to your body, listen to your
Mhm.
body.
So you have stomach pains.
Yeah.
Obviously, it's not a good thing.
No.
Yeah.
If your body's telling you guys that hormones are off, or you're interested in the
Mhm.
Dutch test and we haven't offered that to you, or ZRT or any of these tests we've talked about, stop, carry your eye at work. We want to talk to you guys. We want to
Mhm.
help get you to your absolute optimal health.
Right.
So I'm going to go ahead and start the polling now. Please take a few minutes to answer our questions. This really just helps us get you guys the webinars that you're interested in hearing.
Okay.
And thank you for joining us.
Thank you for joining us.
The Jen and Carrie Show.
We love it. We love you.
We had a lot of information tonight.
Yeah,
This
we
was
did.
fun.
That's good.
Yeah,
That's
I like it.
So,
I love the Dutch test. I think that one's my favorite.
I would like to take one myself. I want to know
Is
where
that-
I'm disrupted.
Is that your favorite? Do you like
It's my
that
favorite,
one too?
and as far as information, actually, yes.
And I
It
like
gives the most in the pathways. You
the-
can't beat that.
You can't beat the
that
pathways.
information.
I agree. And the cortisol too, it gives you like a whole scale and it tells you. So
Mhm.
if you're like, man, I wake up super tired or I'm not
Mm-hmm.
sleeping, and we can tell it, is that your cortisol or not?
For instance,
That's kind of
yeah,
fun.
it's like telling information.
Yeah, all the inflammation. Eat an organic diet. So good. Thank you guys for joining us tonight.
Hopefully we were helpful. We try.